My name is Professor Jennifer Knight-Madden, and I am a pediatric pulmonologist. That means a specialist for lung problems in children. One of the things that I do is to look after children who have asthma. Asthma is a chronic disease of the airways, the tiny tubes inside the lungs. When children have asthma, these tubes are inflamed. They get easily triggered, and that causes cough, wheeze, shortness of breath, and chest tightness. Today, we're going to speak about the use of metered-dose inhalers. We call them puffs in Jamaica. You would be very familiar with these devices if you have asthma. They can be used to control the asthma so that you don't have any symptoms, or if your symptoms break through, to treat that attack to get you better. Now, today we're speaking specifically about a device called a spacer, which when used along with your metered-dose inhaler will make sure that the medication gets all the way down into the small airways where it can do the most work to get you better. Okay, so now we're going to actually demonstrate that spacer. I'm here with Amelia, a very bright girl who's going to help. Hi, Amelia.
Hi, Professor. Hi, everyone.
Great. So here's a spacer. Now, it may come in a container like this. It may come apart, right? So that you can clean it. But when you're ready, you're going to put it together and you're all set. It has a mouthpiece that's protected by a cap, so you're going to just whip that off. We have the Flixotide, which she takes every day to prevent asthma symptoms. And then there's the Ventolin, which if she's having symptoms now, something has broken through, then she uses her Ventolin. What's the first thing we're going to do when we're going to use our spacer? We're going to make sure that our metered-dose inhaler is not expired if we haven't used it for a while. So you take it out and you look at the date to make sure that it's still good. We also need to make sure that there's actually medicine in it, because it will shake and spray long after the medicine is finished. So some metered-dose inhalers come with a counter, but if they don't, ask your doctor or pharmacist to tell you how to know when it's empty. So now we're going to go through how you use it. This also has a mouthpiece with a cap, so you have to take it off. Amelia, do you know where this would go? Perfect. Perfect. So now what we're going to do, shake it, insert it. Now remember, you have to sit up straight, have your head up a little, and then when we're putting this in your mouth, you get a nice seal around the mouthpiece. Then you puff, the medicine comes into the spacer, and you breathe in and out 7 to 10 times. Breathing in and out. Now those breaths don't have to be deep, they don't have to be slow or fast. The beauty of doing it 7 times is that most of the medication will end up in the lung instead of at the back of the throat. And then the parents will be watching that tummy. 1, 2, 3, 4, 5, 6, 7. There we go. So there we go. So the beauty of doing 7 breaths is it doesn't matter if they're slow, fast, deep. As long as you do 7 to 10 breaths, most of the medication is in the child's lungs rather than being at the back of the throat. Now, if your child is younger and won't always breathe in and out through their mouth, we use a spacer with a mask, because once you have that mask having the seal over the nose and the mouth, it doesn't matter whether they breathe through their nose or their mouth, they're still going to get the medication. But what's important is that you get the right size mask. So that's how you use your spacer. And remember, you can watch this video as many times as you want until you're sure you've got it right. And the good news is that your inhalers and the spacer are all available through the National Health Fund. So ask your doctor, your nurse, your pharmacist to give you more information about how you can access them.